I'm Donna Potter. I'm a master trainer at the Center for Child and Family Health. I first came to North Carolina in 1997, just after I finished grad school. And I was working in Roxborough, and I was the only clinician up there working with children under the age of 6. And my whole caseload was children who had experienced all kinds of traumas, sexual abuse and physical abuse and neglect, and they were having these really out of control behaviors that were getting them kicked out of daycares. And I was desperate. I didn't know what to do. I called UNC and asked for some help, and they referred me to Lisa Amaya Jackson at the Center for Child and Family Health. And luckily, she was kind enough to talk to me, and over the course of about a year, we had a number of phone calls where she actually walked me through my cases and taught me trauma-focused cognitive behavioral therapy over the phone. My kids started to get better, and I had so much more confidence. The families had so much confidence in me and in what we were doing because it was working and their kids were getting better. I'm now providing much of what Lisa Amaya Jackson did for me. So within the North Carolina Child Treatment Program, we train clinicians through face-to-face days, but most of the magic is actually happening in the phone calls. So we talk to them every other week about their individual cases, and we're actually helping them to walk through the model in the same way that Lisa helped me. And so now it's not just Lisa and I in Roxborough and Durham, it's actually clinicians across the state of North Carolina who are seeing these kinds of results with all of their kids.
So my name is Lindsay Caldwell. I am a licensed clinical social worker and the clinical director at Hope Services in Raleigh. I've been here for 10 years. And over that time with CCFH, we have trained 30 clinicians in trauma-focused cognitive behavioral therapy. We've trained 10 in parent-child interaction therapy, 2 clinicians in Sparks, and then I personally have trained 5 in PCIT. So the work that we do is really hard. Hearing the stories of our kids and our families and what they've been through week after week can be really tough. But to have an evidence-based model that we can fall back on really helps that therapist confidence. It helps the supportive network that we've built here as an agency, that we're not in isolation doing this work. As far as symptoms with kids post-training, then you really get to see these kiddos get better. You get to see all of their traumatic stress symptoms start to fade away, for them to be able to be happy and healthy and just successful parts of their family and their community again, so that their trauma becomes something that happened to them instead of something that they are. The training that CCFH does throughout the state is enormous. The ability to train clinicians across the state really empowers clinicians and behavioral health to match that of the medical profession, and making sure that we also have evidence-based treatments that work for kids and families. I think it's so important for clinicians, no matter where we are, to have treatment modalities that we know work.
My name is Kathy Stone, and I'm the Child Welfare Program Manager at Wilson County Department of Social Services. In 2015, we investigated 850 reports of child maltreatment, and during that period of time, we served 61 kids in foster care. We began working with CCFH to look at childhood trauma in around 2010 to 2011, and we learned a lot about what trauma really was and the effect it has on kids. We did a lot of training. We ended up training all of our child welfare staff on childhood trauma, and we began to talk about trauma in a way that was different than the way we had just kind of acknowledged it and then moved on from it. But we really started taking a deeper look at the childhood trauma and figuring out what were the best ways to help kids recover from that. Previously, we knew trauma existed, but we really weren't sure what to do about it. Mental health services didn't seem to help, and we couldn't understand why. And we realized now we were treating the wrong thing. So we've developed services in our agency that hopefully help kids recover from their childhood trauma. We address it. We don't just acknowledge it and move on, but we actually slow down and address that trauma. And we can really see that in improving kids' lives. They're more successful. We've got kids who've completed trauma therapy, who have gone on to go to college, who are doing really well. Their behaviors are under control, and the kids themselves can talk about the change that they see in their lives. They do much better. And I think when you address that as a state, then you've really improved the outcomes for every child that the child welfare system touches. And so I think that's a vast impact when you're talking about over 10,000 kids in foster care in North Carolina.